Osteoarthritis in your knees and hips can be painful, but did you know there are now advanced treatment options available? Here to talk about these treatment options is Dr. Joshua Hackel, primary sports medicine physician with Andrews Institute. Good morning, doctor. Thank you so much for joining us.
Good morning. Thanks for having me, Rachel.
Well, I'm actually really excited that you're joining us because I'm not sure we've had anyone from Andrews Institute yet on the show, so I think this is going to be a really cool topic. But first things first, and I always like to ask this from all of my guests, tell us a little bit about yourself and how you got into sports medicine.
Well, back in 2004, when I was finishing my training with Dr. Andrews, I had the privilege of him inviting me to come down here with him and start the Andrews Institute.
Wow.
We've grown quite a bit since then, and now we have subspecialists, fellowship-trained subspecialists in our practice that cover the wide variety of orthopedic injuries we see. My job is primary care sports medicine. My job is to identify those people that need surgery or also identify those that don't need surgery. So for the 90% of people that do not need surgery, I manage those with cutting-edge treatments, and we can talk about those later. For the 10% of people that need surgery, I'll refer them to the subspecialist so that they can be seen as rapidly as possible. The end result is, whether they need surgery or not, they're going to be treated as quickly as possible and back to their regular routine as fast as possible.
So you've been with the Andrews Institute from the very beginning.
Yes, ma'am.
That is really cool. And of course, it's an asset to our community. And we kind of talked a little bit before the show about the advertising that you guys do, which is phenomenal, and talking about how we have this asset in our community. People come from around the country to get some stuff done that they really need to get done. And I think that's really incredible that we have you as a resource. And I'm really grateful that you can be on the show. But let's get down to business. You're here to talk about osteoarthritis. So what is it?
Right. Osteoarthritis is the most common form of arthritis. About 1 in 5 individuals in the United States has some form of arthritis. According to the Arthritis Foundation, about 67 million people by the year 2030 will have a form of arthritis. So it's a very big problem. We see a lot of people with osteoarthritis, not just athletes. In fact, the majority of patients we see are not athletes, but we treat them the same. The athlete and the non-athlete get the same type of treatment. And we have not only the standard treatment options, but we have cutting-edge treatment options at the Andrews Institute. So my job is to identify those individuals that need surgery and also the ones that don't. And hopefully by getting a treatment plan in place as quickly as possible, or getting them to the appropriate surgeon as quickly as possible, they get back to their normal routine fast.
Well, you talked about identifying patients that really need some help with surgery or maybe not. How can you tell if someone actually is in need of help? What are the symptoms?
Typical symptoms for osteoarthritis are joint swelling, joint pain, and stiffness. Commonly in the early morning when they get out of bed, they'll have these symptoms. They can also have them after having been seated for a prolonged period of time.
Okay, gotcha. So how can we help these symptoms?
Well, there are a lot of things that we can do from a non-surgical standpoint. First, we want to talk about lifestyle changes, weight loss. There are also medications, non-steroidal anti-inflammatory drugs, Tylenol. There's a lot of injections, such as corticosteroids and hyaluronic acid. If you notice a patient on their X-ray, they may have one side that's degenerative versus the other.
I'm so glad you brought this fancy graphic. It helps a lot.
So if you look at this is a normal X-ray of a knee right here. You see the joint space there. But on this knee with arthritis, the joint space is degenerative, and so we can put that individual in a particular brace that unloads that side. In addition to that, we can offer them an ablation procedure where we can literally burn the sensory nerves of the knee to reduce their pain. There are also some more cutting-edge options that I provide at the Andrews Institute, such as stem cell injections. Now, these are adult stem cells. These are not embryonic stem cells. But what we have found through our research and treatment at the Andrews Institute is the stem cells can provide a strong anti-inflammatory effect, and the end result is pain relief and hopefully some cartilage regeneration. So those are some of the things that we can offer the patient with osteoarthritis at the Andrews Institute. Now, if they're end stage, in other words, they're too far advanced, we'll get them into our fellowship-trained joint replacement surgeons to get a knee replacement.
Which doesn't sound like a whole lot of fun to me. So tell me about the process of recovery for surgery and those kinds of things.
Well, hopefully we don't have to go down that road. Hopefully,
last resort, right?
Hopefully my job is successful in preventing that from happening. Now, joint replacement surgery is probably one of the more common procedures in orthopedics. For the hip and knee, it's one of the most successful procedures as well. So we're very proud of our joint replacement program led by Dr. Brett Smith and Dr. Dax Steele. They do an outstanding job. They have a program where the patient's in the hospital 1 to 4 or 5 days, depending on how they're doing. Usually they go home rapidly. And after several months of physical therapy, the patient is fairly independent and happy.
Well, why is sometimes surgery a better option? I can imagine that most folks are going to want to avoid surgery, but I mean, you kind of touched on it a little bit, but could you expand upon that a little bit more?
Well, sometimes, like I was saying earlier, the arthritis is too far advanced. In other words, the things that I'd mentioned, they're not going to be effective. And it's my job to recognize that, to not waste the patient's time, to get them in the appropriate surgeon's office as quickly as possible so that they can get back to their life as quickly as possible.
Well, as we're wrapping this up, I think some folks, especially our audience, is probably wondering, is this something I need to get checked out? Where are some resources? Who can they call to get more information?
Well, at the Andrews Institute, they can call the number listed on the screen. We are very proud of the fact that we can get patients in our office within a day or so. And so if you're having any of those symptoms, such as joint pain, stiffness, swelling, feel free to give us a call. We'll take care of it.
Awesome. Well, again, thank you so much for joining us. I think this is going to help a lot of people. We really appreciate you.
It's great to be with you.